Over the last 24 hours, we identified 678 new cases of COVID-19 in the province. Our labs completed about 14,000 tests, and the positivity rate was about 4.8%. There are currently active alerts in 178 schools and outbreaks in 4 schools. There are 282 total cases linked to these schools. In-school transmission has occurred in 23 schools, with 20 of these having only 1 new case occur as a result. Interestingly, when we look at daily new cases in school-aged populations, this week we are seeing an average of 80 new cases a day, significantly lower than the average of 140 new cases a day in this same population the week before school started. Supporting students so they can be in class provides a great benefit to our society and to our children, and it underscores the need to keep reducing community transmission to protect our schools. We still have work to do on that front. Our hospitalizations have declined this week, but remain high with 726 people in hospital, including 119 admitted to the ICU. Unfortunately, 16 new deaths have also been reported to us in the last 24 hours. I extend my sympathies to all who are experiencing loss at this time, whether from COVID-19 or any other cause. Every death leaves a hole in the lives of those who love them, and current restrictions make it harder to support each other the way we are used to. I encourage all of us to reach out to anyone we know who is experiencing grief, to support them and let them know they are not alone. As you can see from our numbers this week, our positivity rate, active cases, and hospitalizations are continuing to decline. This is good news. I know the current restrictions are very difficult for many Albertans, including business owners. As I said yesterday, we are on a positive trend. Our numbers indicate that the restrictions we put in place last month, while extremely challenging, are helping to prevent more people from being exposed and getting sick with this virus. The overwhelming majority of Albertans are doing their part, not only by following the restrictions, but by embracing the spirit of them. We are protecting one another by reducing in-person interactions, which in turn is reducing the number of people who get sick, test positive, and ultimately require hospital care. And with more than 96,500 doses of vaccine administered, thousands of the most vulnerable seniors and healthcare workers now have an extra layer of protection. In a year that has already been extremely difficult, I am proud of the sacrifices and community spirit that Albertans have shown to produce these encouraging numbers. At the same time, we are not in the clear just yet. That is why no additional measures are being eased at this time. There are no changes being announced today. Our cases are falling, but we still have the second highest active case rate per capita in Canada. It is also particularly important to keep our current hospitalization numbers in context. While our hospitalizations have decreased significantly from the peak, they remain high. To put this in perspective, despite the progress we've made, there are just as many COVID patients in hospital today as there were on December 8th, the day that our current restrictions were first announced. This means that our health system continues to experience significant strains, and we must ease this burden as quickly as possible. We need to continue driving community transmission down. That is why it is essential that we keep the current measures in place for a little while longer, and why we all need to make good choices and to rigorously follow all the orders in place. We must keep limiting our in-person interactions as much as possible in every facet of our lives. As we go into the weekend, when more people tend to be out, I encourage everyone to be intentional and thoughtful with their outings and outdoor gatherings, especially as temperatures drop and it may be difficult to stay outdoors for long periods of time. The choices we all make tomorrow, this weekend, and over the coming weeks will help determine how the coming months look in our province. Essentially what we're doing is we're watching our hospitalizations, watching our ICU numbers particularly. Of course, it's encouraging to see the leading indicators of our case counts and our positivity rate going down. But ultimately, what is most important is that we make sure that our acute care system is able to respond to all of our health needs. And to do that, we need to give it a bit more time. And the exact amount of time, again, it will really depend on how we all collectively work together to keep those numbers coming down. We know with other vaccines that when someone has their first dose, there is no end date at which time they're no longer eligible for a second dose. And we know sometimes with some other vaccines that if there is a little bit of a longer interval between first and second dose, that the overall long-lasting immune response can sometimes be better with a little bit of a longer interval. There's still many unknowns with this specific Pfizer and Moderna vaccine, but when we look at some of those other pieces of evidence that come from other vaccines, what we would offer in terms of, first of all, again, as I've said before, wanting to do our utmost that every individual who's received their first dose does get their second dose within the 42-day timeline. If not, they will continue to be eligible and will receive it as soon as possible after that. And we are, of course, with all of our partners in other provinces and territories, working with the federal government to be using our current allocations as wisely as possible and again, making those adjustments in our planning to try to be able to deliver within that 42-day window.